Hi everyone, my name is Alex Quintana, and I chose drug use and addiction as my topic. I look forward to sharing some information I have researched and hope that this presentation can provide some useful insight on drug use, addiction, and how to overcome this major challenge. What is a drug? A drug is defined as any substance, with the exception of food and water, which, when taken into the body, alters the body's function either physically and/or psychologically. This can be in the form of medications or pharmaceutical drugs that are taken to treat and prevent diseases. Caffeine, which stimulates and alters the central nervous system and is classified as the world's most widely consumed psychoactive drug. Alcohol, which also delays the brain's communication pathways and can affect the way the brain functions. Cannabis or marijuana, which contains a mind-altering chemical that is used as either recreational or medical purposes. And illicit or illegal drugs such as cocaine, meth, and heroin that dangerously modifies your mind and body. Drug addiction is a chronically relapsing cycle that is defined as a compulsion to take the drug and a loss of control in limiting intake. Addiction is also a chronic disease in which the brain is altered into believing that the drug provides some type of reward and feeling of relief and pleasure. Typically, the cycle begins with misuse and abuse. This is when drug users take more than legally prescribed and/or takes the form of drug when they don't need it. Then, drug users become tolerant of the drug. The body begins to adapt so that the initial dose of the drug no longer carries out the same effect as it did in the beginning. Now, the drug user must take larger and larger quantities or doses to be able to have the same original effect. Next, the user becomes dependent of the drug. They rely on the drug as a crutch to help them feel normal and function with day-to-day duties. If the drug user is forced to stop the drug or slowly stops taking the drug, the cycle can either begin again or the user starts experiencing withdrawal symptoms. Withdrawal symptoms can include nausea, tremors, sweats, headaches, aches and pains, and serious psychological effects. This image is just another representation of the spiraling distress of addiction. It demonstrates the misuse of the drug by taking larger amounts than intended. Tolerance withdrawal, the persistent desire to obtain the effects of the drug, and the withdrawal negative effects. We must then ask ourselves, how does drug use and addiction affect our health? Drugs and addiction can directly affect different people in different ways, starting with altering the brain's chemistry. Drugs interfere with the way neurons send, receive, and process signals via neurotransmitters. Each drug has a different effect on the brain. For example, opioids affect other parts of the brain, such as the brainstem, which controls basic functions that are critical to life, like heart rate, breathing, and sleeping. Marijuana and heroin can activate neurons because their chemical structure mimics that of a natural neurotransmitter in the body. Amphetamines or cocaine can cause the neurons to release abnormally larger amounts of natural neurotransmitter. However, regardless of the drug, social, emotional, and behavioral characteristics are altered. This impairs one's ability to act and react under any given circumstance. In my previous slide, I discussed how drugs affect the brain. Now let's discuss how drugs affect the body and our overall health. It is still true that each person can be affected differently based on a variety of circumstances, but there is also both long-term and short-term consequences for drug use on the body. We know that drugs alter a person's mind to act and think differently. When affected by drugs, you are more likely to have an accident, whether at home, in a car, or wherever you are. You may be vulnerable to sexual assault, or you may engage in unprotected sex. You could commit a sexual assault or other violent acts. You may find it hard to sleep, think, reason, remember, and solve problems. Drugs can also result in long-term effects, such as harm to your body's organs and systems in your body. This includes your throat, stomach, lungs, liver, pancreas, heart, brain, and nervous system. Drugs can cause cancer, such as lung cancer from inhaling drugs. infectious diseases from sharing injected equipment, and increased incident of risk-taking behaviors. Drugs can cause acne or skin lesions, failure to have hair growth, jaw and teeth issues such as bad breath, teeth cavities, and gum disease. Each drug has its own direct effect on people independently. Here are some common signs and symptoms to look for in suspicious drug behavior. Some physical signs and symptoms include red or glossy eyes, needle marks on the arm, poor coordination, slurred speech, unusual scarring and picking at one's face, constant sniffling of the nose, and dilated pupils. Some behavioral effects are changes in sleeping patterns of being up all night and sleeping during the day, the inability to think straight and make positive decisions, loss of interest in hobbies, sports, or other favorite activities, and sudden mood changes. So who is affected? As we all know, drugs do not discriminate. It can affect anyone, from a baby inside a mother's womb to an elderly person walking down the street. Since drugs can be easily accessed, it is not difficult for someone searching to obtain. According to the Kaiser Family Foundation, in 2016, insurance covered $2.3 billion in addiction and overdose services. In the same year, approximately 20.1 million people aged 12 or older had a substance abuse disorder, and 1.25 million arrests were made for the drug-related violations. In 2018, almost half of all federal inmates were in prison because of drug offenses. This representation comes from the McGraw-Hill Education book in Chapter 8, Drug Use and Addiction. As we can see, in 2016, people aged 12 and older, Black or African American, and American Indian or Alaska Native had the highest percentage of illicit drug use in the past month. If kids at the age of 12 are already included in these types of statistics, we need to start questioning what direction of life we are heading towards and what changes can and need to be done. As a college student myself, I know firsthand how difficult it is to manage a healthy lifestyle. Between studying for classes to maintaining good grades, to managing a full-time job, paying bills, exercising, eating healthier, and parenting, life becomes difficult. It's easy to fall back on a drug that allows your mind to feel peaceful and relax. It's easy to rely on a drug that makes you feel better about yourself and your life. And it's easy to rely on a drug that makes everything just seem better, but it's not worth it. With college students having greater access to drugs today than what they've ever had in the past, we are the most vulnerable to fall into a drug addiction cycle. I'm sure we have all heard our share of drug stories. What they do to you, what they can do to you, how it affected this person this way, but another person another way. So what are some common myths about drugs? 1. You can't get addicted to prescription medication. This is false. According to the National Institute on Drug Abuse, in 2010, an estimated 2.4 million people, 12 or older, met criteria for abuse or dependence on prescription drugs. 2. Addicts are easy to identify. This is also false. An addict can be anyone. It's true that most addicts want to hide their addiction, so they will tend to go even further to cover it. 3. Drugs don't discriminate. This is true. As we discussed earlier, drugs don't care who you are, young, old, male or female. They will attack anyone who gives it the opportunity. 4. Only hard drugs are dangerous. This is false. Nicotine and marijuana are both considered soft drugs, but it is easily, if not, two of the most addicting drugs today. 6. Drugs will solve all of my problems. This is false, false, false. The drugs numb your emotional pain while ruining your finances, alienating your family and friends, making you unpredictable and unreliable, destroying your brain and other organs, and causing addiction. 7. You are the only one who can change your addiction. This can go both ways. As it is ultimately your decision to stop using drugs, there is also family, friends, and resources to assist you on your journey to quit. Legalizing marijuana for medical and/or recreational use suggests that marijuana is gaining greater acceptance in our society. Contrary to popular belief, marijuana can be addictive, and its use during adolescence may make other forms of drugs as likely to become addicting. Prescription drug abuse is the nation's fastest growing drug problem. California has new laws that allow drug users to retrieve clean needles for their addiction, and there are even clinics that will have their medical staff inject the drugs for you. So what is this doing to our future if there are already laws legalizing drugs and easier access for addicts to obtain such drugs? Drug use and addiction is an issue that needs to start being faced and dealt with now, before it becomes too late to stop and control. As we all know, it is easier said than done, but there are so many alternative options than falling into drugs. Exercising, reading, finding a safe and healthy activity, avoiding parties where drugs and alcohol are involved, and surrounding yourself with people who don't engage in drug activities are just a small variety of alternatives to drug use. Listed above are just a few resources for anyone who is battling drug use and addiction. There is always time to stop and get help. If you or anyone you know is a victim of drug use and/or addiction, please don't wait until it is too late. Get the help that you and/or that they need now.